My name is Simon Shurrock. I'm actually a strategic health facilitator and I work with the Together NHS Foundation Trust as part of the Learning Disability Services. And part of my role is to deliver annual health check training at the moment, which we've been doing a big project over the last year to all 76 surgeries in the localities. So the idea is we try and support the GPs and the services there and how they can improve communicating and working alongside our very vulnerable client group, really. So we produce a lot of additional information like pre-health check questionnaires to support them what they're doing, also lots of easy read information as well, which actually is helping them to understand and communicate better with our particular client group. So you don't want to tell them what to do, but support them what they're doing.
I'm Dr. Jarvis. I'm Learning Disability Champion GP, I guess, for Gloucestershire. So the Theatre Forum, I guess we'd call it, is looking at reasonable adjustments for people primarily with learning disability. So how, as GP surgeries and the health community at large, can adjust what we're doing and how we do it to accommodate people whose needs are just that little bit more different or challenging compared to our normal population.
And the idea is to work with Inclusion Gloucestershire, who are delivering the forums today, so we can communicate to the GPs and staff in other ways. So instead of doing our micro teaching we've been doing all over the county, the next stage is now, well, how can you make it more visual to people, more personal to people? So by producing lots of documents today, which we've done already, which is all standardised now with the practices, we can incorporate that into the forum theatres so that they can go away with the same information, but be more receptive about, oh, what about reasonable adjustments? This is how we can make it work. This is how we can learn off other people. And this is what other practices are doing, other GPs are doing, or practice nurses are doing. So we're all learning off each other. And the big aim is to provide a lot of choice, to make a difference to people's lives, and to improve their quality of life.
So simple things often like different language, easy read language for letters, or longer appointment times, or quieter waiting areas, or shorter waiting times where that's feasible. It's just trying to adjust things, often in very small ways, to make things easier.
I was a bit sceptical initially because knowing how busy practices are now and their new contracts now, I was a bit concerned it may not work, but it's actually worked extremely well. I mean, this is the fourth one today in Cheltenham, and it backs on to the micro teaching we've been delivering already and support with all the surgeries, with our clinicians as well. And this is another way of communicating to a group of people who are very, very passionate about what they do in surgeries, which is really important.
And I've picked up some things that I hadn't really thought of before, so yes, it is effective. And I've been making notes for myself, I've been scribbling away often at times, things I need to be doing differently. So yes, I think it is effective. And actually it's quite fun, interactive learning, without being too threatening.
First of all, a better understanding of reasonable adjustments, looking at the whole person the whole way. It's been really, really important. And also people generating communication between each other so they can link with their colleagues and other surgeries about what the best practice would be, how it's worked for them. So that's really, really important. Those are the two areas I think has been quite a highlight here.